So, Guy, we're currently in National Smile Month, but new research has shown attitudes towards smiling have changed during the pandemic. Can you tell us about these changing attitudes and the major factors that have contributed to these attitudes?
I don't think we've seen a dramatic change. What we've seen is a real amplification of some of those trends that we were seeing anyway, because I think people have spent a lot of time on kind of Zoom and all those other kind of virtual platforms, all that kind of stuff. And all of those things that bothered them a little bit have now been very much brought to the center and the focus of their attention. Plus, there's a little bit of a movement across all sorts of kind of behaviors towards people investing in themselves and looking after themselves, whether that's people eating well or trying to get in shape. And actually, oral health has become a really important part of that. So, in terms of specifics, we've, from some research the National Smile Month team and the Oral Health Foundation have done, we've seen that around about a third of people have now become more aware of the color of their teeth. A quarter of people are now more aware about the alignment of their teeth, and more people are now looking and seeking out treatment to improve those aspects of their dental or oral health or appearance that they were maybe a little bit unhappy with before the last 12 to 15 months, but are now really focused on, particularly because of all that time we've spent staring at our own faces online.
Okay, so is there a connection between these changing or these attitudes and not having the same access to perhaps dental checkups during the pandemic, do you think?
I'm not sure the two things are directly related. I think sometimes that's caused some frustration with patients that maybe want to do some of these things, and because of all the kind of practical challenges with what we've all been through over the last year or two, it's sometimes been difficult to do those things. And clearly the most important thing is that those kind of encounters with dentistry are done in a high quality way, in a safe and obviously with all the appropriate measures in place, particularly up until what we hope is the tail end of the COVID restrictions. But everything's taken a lot longer in dentistry for reasons that I'm sure I don't need to explain in lots of detail.
Mm-hmm. And so does social media play a role in this, or sort of the influencer culture, do you think? Guy or Ben, you can jump in here.
Ben, you go ahead.
With regards to the influencer stuff, I realistically think there's a lot of self-influence on this. If you're on a Zoom meeting, you can see your smile constantly. I think it's really people taking that to heart. So I think that's the big change. So influencing things, they can be a challenging place to get information from for patients. So it's really important patients understand what that is an influencer for, because there are dental influencers, people who deal with dentistry all the time. They're a professional, they're a dentist, they're an orthodontist, and there's people who have got an opinion of dentistry. There is a massive difference out there, and what people are influenced by. I personally am finding patients are looking forward to unveiling their smile more when they take the mask off. So they're walking down the street, they're not having that. They're now very aware of their smiles because they're aware they can't use it to say hello to people.
Yeah.
I would certainly support that, and that when looking at Instagram or whatever social media platform you prefer, it's about recognizing that why are these people promoting these services, and sometimes it might be because they have had a really great experience and are working with a practice to talk about treatment options in a very reasonable, open and transparent way. And sometimes it's very much about selling something which isn't underpinned by those really important aspects of keeping your mouth really healthy and making sure that there isn't any decay or any problems with the gums before that treatment has begun.
Mm-hmm. And so you mentioned face masks and video calls. As these things are continuing to remain normal for us, as we're trying to protect the people around us, what advice would you give to people who perhaps have lost confidence in their smile during the pandemic?
For me, I would actually use their oral health as this journey to feel control back again. Brushing your teeth twice a day with a fluoride toothpaste, phoning your dental practice up and seeing how often they want to see you. They may just do a simple Zoom call like this and do a really good oral health journey, and then speak to the practice about what are your wants. Do you want your teeth aligned? Do you want to change the whiners? Do you want just to make sure your mouth is a very healthy place? Learn that program. And the big thing before people take that mask off again, use this as an opportunity for change. You can control your smile. And have a chat with the professionals about that.
Mm-hmm. Well, that's absolutely fantastic. Thank you so much for that. Is there anything that I've not asked that you would like to tell our listeners about this topic, you're more than welcome to just, say anything.
I suppose the final point I would make is really just to remember that if it looks too good to be true, if it looks like it's going to be too quick, too easy, then it often is, because the most important thing, as I've mentioned, is to make sure that you have a really good relationship with whichever dentist or members of the dental team are looking after you, and that any kind of decisions about cosmetic treatments in particular, straightening the teeth, are underpinned by that really great relationship and a really healthy set of teeth and gums before you start. And some of the options out there now make that look rather easier than perhaps it might have done a year or two, and that there's a reason that they may ultimately prove to be problematic for some patients.
For me, it's about educating yourself. So if you want any further information about the Oral Health Foundation's Smile Month, visit dentalhealth.org. Or if you want to talk about aligning your teeth and that sort of thing, the Oral Health Foundation and the British Orthodontic Society have a campaign called Safe Brace, which educates and informs patients having orthodontic treatment. So visit the website, which is safebrace.org. And there's always the Invisalign website as well to visit for more information on straight teeth.
Amazing. Thank you so much for that advice. It's really helpful. It's been really great to talk to you.